Hello to everyone and welcome to today's episode of our podcast Dare to Know Yourself, where we will be discussing ADHD in adults. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurological condition characterized by difficulty paying attention, impulsivity, and hyperactivity. It is often associated with children, but also can affect adults, and is what we are going to talk about today. In this episode, we will discuss the symptoms, causes, and treatments of ADHD in adults. And to do so, I have the pleasure to be with Carmen. She's a psychologist here in Seniors, and she has many years of experience working with adults and children in learning difficulties and ADHD. Hello, Carmen. How are you?
Hi, Albert. Hi, everyone. Thank you for for giving us this space to talk about ADHD in adults.
I think it's going to be very interesting to our audience and can bring a lot of value to them.
Definitely.
So let's start from the beginning. What is ADHD?
So as you said on your introduction, ADHD, it's a behavioral pattern characterized with inattention, hyperactivity, and impulsivity. Okay, so what we see is adults, or in this case, particularly children, that struggles to pay attention or to stay focused on tasks and usually gets to wander around or tune out from situations when the task is too demanding or asks for too much attention for them in that particular task. The other side we have is the hyperactivity, which is this constant moving or this need to be always doing something. Okay, so what we see usually in children, or it's what we have observed, is this disruptive behavior that it's not proper on certain settings, like for example a classroom or a workplace, that someone who is constantly moving or constantly doing something around. Okay, and then we have the impulsive behavior, which is the part of acting on a whim, like acting without thinking or doing things without thinking or without taking into account the consequences that action could have. Okay.
And what terms are associated with ADHD?
Well, there are a lot of terms associated with ADHD. For adults mostly, one of the main terms that is associated with ADHD, it's, for example, procrastination. Adults with ADHD usually tend to procrastinate or to avoid doing certain tasks that will demand them to be focused on the task for long periods of time, because it's a hard cognitive activity that they need to perform, and they need to maintain that for a long period of time. And usually they tend to avoid those kind of things. So there where the procrastination comes. Usually another term that is associated with ADHD is laziness, that it's also kind of associated with procrastination, because they tend to be cataloged by others as people who are lazy, who don't do their, for example, home chores, or they don't do the work that they need to do because they're constantly moving or they're constantly doing other things. So they are considered some kind of lazy. And also by themselves, they consider themselves as lazy people. Like, I'm lazy. I didn't do these because I'm lazy. So maybe you didn't do it because it was hard for you to do it. And we tend to avoid some kind of hard situations, right? So it's usually their thing, the self-perception that they have, it's usually of being a lazy person. Another term that is also associated, it's frustration, because school systems or work systems are not prepared for them, or it's like their brain is wired differently. They learn things differently, and the way they work, it needs to be different. Okay, so most work environments or classroom environments are specifically designed to attend majority of people or more people, and these, we need to consider that they are like part of the population, not the total, right? They are some kind of a minority. So in those situations, they tend to frustrate or get frustrated with themselves and also with others, because they don't accomplish the expectations or the goals that are set for them in those environments. As I said, because the brain works differently for them.
And how can we identify ADHD symptoms in a regular day?
Well, there can be a lot of symptoms. I think one of the most significant that my patients come is mostly disorganization. So they struggle to organize not only their time, but also the activities. Like they don't know where to start with one activity. They don't know what comes next. They don't know how to sequence those activities. So they struggle with that. So mostly organization, also organizing like activities or appointments that they need to do on their calendars. They tend to double book appointments with doctors or with friends, or a work thing with a social thing. So they struggle with that. Another area that they struggle or they come is forgetfulness. They tend to be very forgetful about things, like not knowing where they put their keys or not knowing where they put their phones, and losing a lot of time searching for them, which in consequences they take it like more time to get out of home. Another thing that they usually report is constantly being late or not being able to remember the things that they were doing. So for example, it's very comical. Patients said, like, sometimes I go to the kitchen and I forgot completely what I was going to do on the kitchen. So that short-term memory somehow is affected on ADHD, as I said, because the brain is wired differently. And they tend to have these mishaps on their daily basis. So this is one of the most important things that they come. They obviously, with this, they tend to have difficulties at work and following up like deadlines and accomplish things at work. And that's one of the reasons why they come to consultation in adulthood. Another thing could be socially. Socially, they struggle to, for example, follow people's conversations, or they tend to interrupt, which causes like for the other person to perceive this person with attention difficulties as rude or not as a good friend, because they don't remember things, or they don't remember their birthday, or they don't remember the things that they were talking about. So these usually tends to cause some kind of social interaction distance.
And knowing all these, are there types of ADHD, or there's just one?
No, there are types of ADHD. This is a great question, Alvaro. Thank you. There are three different types of ADHD. We have the inattentive type, where the attention is mostly affected, and they have none or less hyperactivity symptoms that are not considered for the diagnosis of hyperactivity. There is the other side, which is hyperactivity, where the symptoms of hyperactivity are the most significant, and they still can focus on activities, but they are always on the move, or all constantly moving, or constantly having excess of energy. And there is the combined type, where they have both symptoms in equal measure, and it's affecting most areas of their life.
Okay, and who is in charge of the diagnosis?
So in charge of the diagnosis, it has to be usually a multidisciplinary team. So, for example, the pediatrician or the GP with the consult of a clinical psychologist, also with a psychiatrist. All of them perform different tests, and all of them collect information from different areas of the person who is suffering this, and they assess or they consider among their discussion that you have ADHD, for example.
Okay, and could you explain how we do it here in CNews?
Yes, of course. Here in CNews, we do it with a very specific process. Okay, so firstly, we provide a first interview where we collect information about the symptoms. We talk with the person and we talk about their daily life and the struggles that they have in their daily life. Then we proceed to do a full assessment of the cognitive area and the executive functioning. The executive functioning is like the director of all the things that, or all the behaviors that we do. And one of those executive functioning is attention. So usually in people with ADHD, that area of the brain is affected or works differently. So they tend to have not only difficulties in an attentiveness, but also, for example, initiating an activity or being able to move from one activity to another. So that part of the brain, which is the frontal cortex that is in charge of that, it tends to work differently. Okay, so that's the reason why we assess also executive functioning. cognitive functioning, it's like we would do some kind of, if it's like if we are doing a radiography of your brain to know how it works and how, or the way you think or the way you process information. So we can gather specifically symptoms or objective symptoms that could be related to that way of working of your brain. And we also, in adults specifically, we need to assess the emotional side, because there can be some emotional diagnosis that could affect attention. Okay, so for example, if you have been suffering from a major depression for a long time, that could affect the way that you tend to think or the way you perceive things. So usually we need to discard any kind of emotional symptoms.
Okay, and what treatment does ADHD has?
So I usually recommend a combined treatment. Again, there is the medication treatment, which should be provided by a psychiatrist, but there are also strategies and coping mechanisms that could be taught to the person who has ADHD. And it's one of the major reasons why adults with ADHD come to see me, because they want to learn how to time management or how to organize their activities or how they could set real goals that will work for them. Another thing that it should be addressed in therapy will be the psychoeducation of ADHD, how your brain is working. Because even though if you have ADHD, your ADHD won't be the same as another person's ADHD. So we do an intervention plan, which is directly to that person specifically, and how that person or how the brain of that person works, so they could understand better and they could learn how to cope or compensate those things that they're struggling more.
Okay, and what other disorders can be associated with ADHD?
Especially in childhood, the opposite defiant disorder is associated with ADHD. This is characterized mostly by children who are defiant towards the authority or to tend to say constantly no to certain things or do the contrary of what they are asked to. So this is very common to be present together with the ADHD. But another thing that could be associated with ADHD, for example, is anxiety, because definitely some of the symptoms of ADHD could cause anxiety in certain situations, especially if you have a learning, as I said, the system doesn't work the same for ADHD. So if you have learned towards that system, it could cause anxiety for you not to meet those expectations and feeling somehow that the world, it's not a good place for you. Okay, so you can have anxiety with that. But also we need to discard some difficulties, like for example the autistic disorder. The autistic disorder sometimes could be confused. They could be present together, but sometimes it could also be confused with ADHD because they have symptoms that are similar but are not the same, and the area that is affected is different, and the treatment will be different too. So we need to discard that there is no ASD signs. And also, for example, learning difficulties. They could be present together with the ADHD, and most of the time they are present because ADHD affects academic abilities and workplace abilities, but a learning difficulty should be treated differently. So they could be present together, but it should be diagnosed also because the treatment is different for both of them.
Okay, so well, Carmen, thank you very much for all this information. I think that it can bring a lot of value to our audience and the people who are listening or watching us, and hope that it can be valuable information for you. And thank you very much for all your chat.
Thank you for having me, and I hope that this helps people to understand better ADHD.
I'm sure it will.